everyone, welcome to another counseling outreach section. And of course, I still remain your online counselor. This is Royal Care Counseling Outreach. My name is Rachel. So today we are going to be talking on prostate cancer awareness section 2. Yes, if you are new here, please don't forget to subscribe and of course turn on the notification bell so that whenever we post any video, you will be the first person to know. And if you are new here, don't forget to go view our previous videos, meaning go watch our previous videos. We spoke on prostate cancer awareness section 1. So today we are going to be talking on this section 2. Yes, and I'm going to start with the clinical features. Number 1 of the clinical feature is asymptomatic, meaning it doesn't show any signs, any symptoms that you have prostate cancer. You have to be the type that always go for regular checkup. So as we age, our body is demanding that we always go see our medical practitioners to always check our body system so that we would not be dying and we wouldn't be aware of it. So we should always see our medical practitioner. We should always seek medical help as we age, meaning regular checkup should be done, should be carried out, because like this asymptomatic, you wouldn't even know that you have prostate cancer if not being diagnosed of. So it might not show any symptoms. Number 2 of the clinical feature is obstructive symptoms. That obstructive symptoms have subtitles like small children underneath it. So stay with me as we go through all those small children underneath obstructive symptom, weak stream. And the A parts under obstructive symptoms, I'm going to list them alphabetically. The A part is weak stream, that is, the urine is very weak. It comes out very slowly. The person will take time to urinate. Instead of the person to be able to urinate in a normal form or a normal way, the person will be slowly urinating. That's why when some people tell you, I want to use the restroom, I just want to pee, you say, Oga, are you sure you went to pee? Abi, you went to poo? And the B part of it is existency, meaning the urine takes time before it comes out. The first one, weak stream, the urine comes out very slowly. The B part is that this time around the urine takes time before it comes out. The first one, it comes out, but it comes out slowly. But this existency, it takes time before it even starts coming out. And the C part of it is feeling of incomplete emptying, or you can call it feeling of incomplete emptiness, meaning the person just finished peeing and it comes back, and within the next few seconds you say, I want to pee again. As in, it keeps feeling, oh, I've not finished emptying my bowel, I still want to pee, I still want to urinate. So the person keeps visiting the restroom occasionally just to pee. The person feels, I'm not yet done, but the urine is not really coming out. So the person will go back after urinating, and the next few minutes is also running back to the toilet. The D part of these obstructive symptoms is straining, meaning the person is forcefully trying to urinate. The person is struggling to urinate, is forcing himself to urinate, but the urine is not coming out. So it's trying hard, like when you are trying to urinate as if you are trying to poo. That's this straining. The letter E of these obstructive symptoms is urine retention. The person in question that is faced with prostate cancer can stay as long as 20 minutes in the toilet just trying to pee. So at this stage you think, okay, I thought you say you want to pee, why did you go and poo? No, the person didn't actually go to poo, the person went to wee, but the person is finding it difficult to pee. That's why the person is staying as long as 20 minutes in the restroom. Number 3 of the clinical features is irritative symptoms. These are the most common, and these irritative symptoms are divided into some sections. They have small kits under it, just like the obstructive symptoms. That's the number 2 of clinical features. So now let's move back to number 3 of the clinical features. With number 1 of the third clinical features, which is irritative symptoms, is urgency. They are always running to the toilet, always in a haste. When you see them running, you say, I thought you said you want to pee, why are you running like you want to poo? You see them always in a haste, kitty. Then number 2 of it is, that's the B part, is frequency. That is, they are always visiting the toilet, they are always visiting the restroom occasionally. The urgency is that they are always running to the toilet because it's urgent before they pee on their body. Why the frequency is always going to the toilet. Then the C part of this is nocturia. They are always, okay, this one merges the urgency and frequency together. So they are frequently and regularly visiting the toilet at night. They are always visiting the toilet at night when they ought to be sleeping or resting. You see them occasionally visiting the toilet. Then the D part of this is urgency incontinence, meaning they are always feeling like they want to pee. They are not satisfied with them peeing, but the more they try to pee, the more the pee is not coming out. So they're always feeling like I want to use the restroom, I want to pee, but the pee is not coming. So they keep on trying. It's not coming. So the urgency incontinence keeps coming to them like I feel like peeing, but they are not. The pee is not coming. We're going to be talking on the symptoms of advanced diseases. Meaning, when we use the word advanced, meaning it's no longer just prostate cancer. It has spread. It has advanced. So here are some symptoms you will see. Number one of such is hematuria. When you start seeing blood in your pee, meaning it's not just prostate cancer alone, it has advanced. So you see hematuria. Number two is dysuria, meaning you can't pee. It has expanded from being a prostate cancer to affecting some unknown part of your body. So number two is dysuria. It is advised that once you start observing that you have cancer in a particular axis of your body, you see your health practitioners so that cancer doesn't spread. Once cancer spreads and starts affecting your liver, your lungs, your brain, your life is at risk. It poses more threat to your life. And number three is penuria and suprapubic pain. That is pains around your genital area, around your genital axis of your body. You start feeling pains around there. Then know that it has advanced from being just prostate cancer. And number four is erectile dysfunction. I think I talked about it in my previous video. Please go and watch it. If you are new here, please don't forget to subscribe so that whenever we post any new update, you'll be familiar with it. You'll be able to understand. You won't be lost. So erectile dysfunction is number four, meaning the man is not going to be sexually active with his sexual partner. He won't be able to be erect, to be able to sexually perform with his partner, meaning it's not just prostate cancer alone. It has advanced, it has spread. And number five is constipation. The person finds it difficult to poo. I'm not saying that when you have constipation, you automatically conclude that you have prostate cancer and you start running helter-skelter, kitty. Please see your health practitioner. Or you start saying, okay, for me to have constipation, that means I don't just have prostate cancer, it has advanced. No, please see your health worker. Number six is bowel obstruction, meaning your large intestine bowel has been obstructed, has been affected. So you should see your health worker. Number seven is anal bleeding or blood in poo, meaning your poo becomes black and smelly and sometimes it's mixed with blood. Please see your health worker. You might just be having prostate cancer that has advanced. I'm not saying if you start having blood in your poo, you automatically feels okay, you have prostate cancer that has advanced. That is why I said see your health worker. We are going to be talking on the treatment of prostate cancer. Number one is digital rectal examination. We normally call it DRE. So once prostate patients hear about digital rectal examination, they start running. The moment the doctor said, okay, I want to insert my finger into your anus to confirm or to examine some spots in your genital axis, they start running. I don't know why they avoid it, but it's part of prostate treatment. So please do not run away from such treatment. Number two of the treatment of prostate cancer is chemotherapy. That has to do with your regular checkup, your regular routine, seeing your health worker, and the medications you have been prescribed or asked to take. That is called chemotherapy. Then the next one is surgery. That is, sometimes you might have to undergo some surgery to help correct the already existing problem going on in your body. That's the already existing prostate or the already existing cancer in you. Then the last but not the least is radiation. That is the exposure to some radiations that will help kill the abnormal cells that are still existing in your body that are causing that cancer to spread. That radiation will help to kill those abnormal cells. Just as I said, cancer has to do with abnormal cells which spreads in the body. So radiation will help to kill those already existing abnormal cells in your body. Now we come to the end of prostate cancer. So stay put to our channel and don't forget to subscribe, because we are going to be talking about benign prostate hyperplasia. That has to do with some other sickness or illness that's closely related to prostate cancer. So there are some symptoms that are similar. So once some people have benign prostate hyperplasia, they start thinking or imagining that they have prostate cancer, but it is not the same. Benign prostate hyperplasia is closely related to prostate cancer, but not the same. And if you properly manage benign prostate hyperplasia, it can advance to prostate cancer. But if it's well managed, it's not going to advance to prostate cancer. So we are going to be talking of that, and we are going to be talking of vasectomy. That has to do with permanent family planning in men. We are going to be talking of the advantages of vasectomy, and we are going to be talking of the disadvantages. And I am going to bring you my own opinion on vasectomy. And of course, the essence of this is to help you see your counselor, because I am a counselor and I will advise you see your counselor. Once you see your counselor is definitely going to refer you to your health worker, so that you don't die of anxiety and depression, and that doesn't lead you to suicide. Your counselor will help modify your irrational thought to help you modify it to a rational one. So your counselor is very essential. Make sure you always see your counselor. And today we come to the end of this counseling outreach. I still remain your online counselor. My name is Rachel. Bye-bye.